So the title of the thesis is District Health Management and its Association with Health System Performance in the Eastern region of Ghana. The candidate is Anne-Christine Stender Heerdegen. The floor is yours.
Thank you so much. I'll go ahead and share my screen. Do you all see that well?
Yes, we see you.
So, of course, want to thank everyone for taking the time to come today and see my virtual defense on district health management and its association with health system performance. Today, I'll be presenting 3 chapters of my dissertation. I'll start out with a brief background. Thereafter, I'll present each of the 3 studies, mainly focusing on the results, and lastly, I'll conclude with the implications of my findings. First of all, I want to state why it's important to study district health management. Many low and middle income countries, such as Ghana, where this study takes place, have decentralized health systems where district health managers often are made responsible for the implementation of national health policies, and thereby also held responsible for whether the national health objectives are being reached. In Ghana, there is 260 districts. In each of these districts, there is a district health administration, such as the one on this picture, and this district health administration is operated by a district health management team. This district health management team is responsible for ensuring that the people living within their district have access to high quality public health services. That means that the district health managers need to staff the facilities, they need to ensure that the health workers are motivated, and moreover, they need to plan and organize that the right resources are at the right place at the right time. The reason why it's important to study district health management is because it's been stated that district health management is weak and that this may lead to failures in achieving national health objectives. Nonetheless, can everyone please mute? Sorry. So this, however, so there's weak health management. However, there's limited empirical research on district health management, its weaknesses, and its association with health system performance. In order to strengthen district health management and its potential weaknesses, we need a better understanding of it. That leads me to the aim of my thesis, which is to analyze district health management and its association with health system performance. Ultimately, we hope to fill this black box and gain a better understanding of district health management that may contribute to guide future management strengthening strategies and potentially strengthen health systems. The 3 studies I'll present today as to this overall goal. The first one by looking into aspects that affect district health managers in carrying out their job and ultimately in ensuring a healthy district population. The second one looks into the management capacity among district health managers and its association with health system performance. And the last one looks at management practices related to staffing of the health facilities. Before I dive into the results, I want to state that my PhD is an integral part of the project PERFORM2Scale, which is led by the Liverpool School of Tropical Medicine and a research consortium consisting of various European and African partners. The PERFORM2Scale project aims at implementing and scaling up a management strengthening intervention at district level in Ghana, Uganda, and Malawi. With that being said, the PERFORM2Scale defined the study setting of my PhD to the eastern region of Ghana, and more specifically to these 6 districts within the eastern region. So the first study I will be presenting on aspects affecting managers in ensuring a healthy district population was published in July 2020. This was a qualitative study that was based on in-depth interviews with the district health managers themselves, as well as their regional supervisors, as well as peers working in NGOs. In the analysis, we used a systems approach and we looked at individual, organizational, and broader contextual factors that may affect district health managers in carrying out their job. Within the broader aspect, we identified 4 major factors that may affect the district health managers, namely the resources, the infrastructure, the work conditions, and the stakeholders within the district. In terms of resources, we found that there was a lack of human resources at the district level as well as the facility level. There was also a lack of financial and material resources, the lack of financial resources primarily being caused by a delay in reimbursements of national health insurance funds. In terms of infrastructure, we found that poor road conditions and telenetworks could be a barrier for the district health managers to carry out their activities such as monitoring and supervising health facilities, especially due to them lacking material resources such as robust vehicles to navigate roads such that are illustrated at this picture. In terms of work conditions, the study respondents reported that there was overcrowded offices with hot temperatures and poor internet. And I think we can all say that that is not factors that lead to a productive environment. In terms of the district health manager, or the district stakeholders, we're talking about stakeholders such as the local government and NGOs within the district. Their priorities as well as their relationship with the district health managers may be important in terms of contributing with additional support and resources for the district health managers. At the organizational level, we found that district health managers' decision space, as well as organizational relations and the availability of management support systems played a role in impacting the district health managers. So, first of all, I want to state, in order for district health managers to ensure a healthy district population, they need to be able to make decisions that are responsive to what they see of the district health needs. We, however, found that the district health managers had a limited decision-making authority, largely because their agendas were dominated by vertical programs that came along with earmarked funds and prescriptive guidelines. In terms of organizational relationships, we found that there was positive team dynamics within the district health management teams, as well as between the district health managers and their supervisors at the regional level. This played an important role in support in having the district health managers carry out their facilities, or their activities, So lastly, we found that the district health managers were supported, enabled, and held accountable to doing their job through a well-functioning performance management system, as well as access to job description, policies, procedures, and functioning health information systems. At the individual level, we looked into the district health manager's ability to carry out their job. In terms of competencies, we found that the district health management teams were guided by well-qualified district directors. However, we did also find that there was a call for additional management and leadership competencies among the remaining managers. In addition to competencies, the district health manager's ability naturally also depends on their authority to make decisions and whether they have the available resources. We also looked into whether the district health managers had a clear perception of the role, which we find that they did due to factors mentioned in the previous slide, namely positive team dynamics, access to job descriptions, and supportive supervision. Lastly, we looked into the district health managers and whether they were motivated to put an effort to carry out their job. We found that supportive supervision, team dynamics, and the purpose of ensuring a healthy district population was motivating factors. Meanwhile, the district health managers felt diminished by their limited opportunities for growth, as well as their limited decision-making authority. So clearly, the district health manager's individual capacity is rooted in factors in the organizational and contextual environment. So that leads me to the conclusion and the key message of this study, which is that district health management is complex. It's influenced by multiple interdependent factors at various levels, and that holistic approaches are needed in order to strengthen district health management in a sustainable way. So now moving to the second study on the managerial capacity among district health managers and its association with health system performance. This was published in January 2020. So this was a quantitative study where we distributed a cross-sectional survey to all district health managers within the 6 study districts. The cross-sectional survey covered aspects such as the district health manager's socio-demographic background, their management experience and training, their competencies, etc., and allowed us to look into the managerial capacity among district health managers. Meanwhile, in order to explore the association with health system performance, we looked to the Ghana League Table of District Performance, which is a table that ranks all districts in Ghana according to how they perform on 17 different public health indicators. This table allowed us to group the study districts into high-performing, mid-performing, and low-performing districts, and ultimately gave us the opportunity to test whether there was a significant difference between district health managers in high-performing districts versus district health managers in lower-performing districts. In terms of the managerial capacity among district health managers, I won't go into all our findings. However, we did find that the most frequent educational background was either clinical or public health, that most of the district health managers' highest qualification was a certificate or a diploma or a bachelor's degree. We also found that more than 1/3 of the district health managers had less than 1 year of management experience prior to their current position, and that less than half had received formal management training. Lastly, we found that almost all the district health managers reported a desire to strengthen their management and leadership competencies. In terms of the association with health system performance, our hypothesis was rejected for some variables, meaning that there was no significant difference between the different performing districts. This was in terms of the district health manager's education, their age, the gender, management experience and training, and so forth. Meanwhile, we did find that our hypothesis was accepted for other variables, meaning that there was a significant difference between higher performing districts and lower performing districts in terms of the manager's teamwork, communication within teams, organizational commitment, and self-efficacy in terms of management and leadership skills. The district health managers in the high performing districts were significantly more likely to rate these positively. So our study shows that there is an indication of an association between district health management and health system performance. And moreover, it suggests that district health systems may be strengthened by enhancing district health managers' team dynamics, their organizational commitment, and self-efficacy. Now coming to the third and the last study of my PhD was published in June 2019. As I said in the introduction, the district health managers are responsible for staffing health facilities. However, they don't have the authority to hire or fire personnel, so they rely on health worker transfers, and this study looks into how these are managed. This was a mixed method study that took place in 3 of the study districts. It was based on a data triangulation approach where we combined in-depth interviews with health administrators involved in transfers with a cross-sectional survey of health workers who had been transferred and a review of posting policies and procedures. So in order to ensure equitable access to care, the district health managers have to staff the health facilities equitable. They may do so by transferring health workers from one health facility to another. However, at the same time as ensuring equitable access to care, they also have to ensure that the health workers remain motivated and satisfied in their postings so they deliver optimal care. We found that it could be a challenge to balance these two, especially when health workers were transferred from a preferred location such as a city to a less preferred location. However, one way to balance these two or try to balance these two is by at least ensuring a good health worker transfer. It's also stated in the posting policy that posting shall be done under fairness and transparency. However, I mapped the transfer processes and found that this is not always the case. The health workers were hardly involved in their transfer decisions, which means that these transfers often came as a surprise. A district health manager said how a health worker came back to him and said, "Why? What have I done? Have I done anything wrong?" So I had to explain things to her that we need your services here, and that's why we're transferring you. Not that you've done something wrong. She was here crying. We also found in the policy that health workers may initiate or transfer or reject transfer themselves. However, in practice, it's not certain in which cases this will be granted. A district health administrator said, all we have to do is give a good reason, just maybe in an informal discussion, why they want to be moved, and if the reason sounds good enough, we give the approval. So basically, we found that the policies and procedures that should guide the management processes do not provide clear guidance on how health workers should be involved and in which cases transfers can be granted. This may lead to health workers' feelings of uncertainty and dissatisfaction, which may negatively affect their performance. So the conclusion of this study is that ambiguous policies may promote managerial transfers that may lead to suboptimal delivery of care. Moreover, that in order to ensure fair and transparent transfer practices, we need more clear and health worker-centered policies and procedures. So now, coming to the conclusion and implications of these findings, as you heard throughout the 3 studies, we identified several factors that needs to be addressed in order for the district health managers to be better able to carry out their job and ultimately to ensure a healthy district population. Among other things, we found that there was a lack of management and leadership skills among the district health managers. One way to embed management and leadership skills within the system may be to institutionalize qualifications for management roles. This can either be education-based or experience-based or training-based requirements. We also found that the district health managers had a limited decision-making authority, which may both impact their motivation, but it may also make the district health systems less responsive to the needs within the districts. So enhanced district decision-making authority may be approached by adapting policies or by creating informational channels that promote bottom-up communication where district health managers somehow are more involved in district planning and priority setting. It may also be approached by strengthening regulatory frameworks for vertical programs funded by development partners in terms of ensuring that the district health managers have more flexibility in how resources should be used. Moreover, we found that there was non-optimal ratings of teamwork, commitment, and self-efficacy among district health managers. This may be approached by implementing team-based management training, such as the action research approach, which is used in the PERFORM2Scale intervention, or by promoting inter-district learning. Again, to embed it within the system, these would have to be institutionalized. We also found that health worker performance may be negatively affected by non-fair and non-transparent managerial practices. As I stated, this may be approached by developing human resource-centered policies and standard operating procedures. However, it could also be approached by introducing human resource key performance indicators. If the district health manager's performance is assessed on factors such as health worker satisfaction, absenteeism, turnover, believe that that could lead to a behavior change. Of course, accountability systems are also required. Lastly, it's of utmost importance to ensure resource availability so the district health managers can carry out their job. This may be done by improving timely disbursement of funds and setting up accountability to ensure timely disbursements of funds. Naturally, all these approaches would require more research. First of all, what are the absolute necessary competencies among district health managers? What are the approaches to strengthen management skills, commitment, teamwork? What are the bottlenecks in disbursement funds? However, I think that if we successfully target this, the district health managers will be better able to reach their vision of a healthy population for national development. With that being said, I want to thank a lot of people, both for attending the PhD defense today, but in particular my supervisors, Casper and Jörg, and my committee members and chair, Marjolein, Moses, Christian. Thank you for your effort today, but also especially Moses and Marjolein for your engagement throughout my PhD. I also want to thank the School of Public Health, University of Ghana, and the colleagues there who was a big part in collecting the data and also writing the manuscripts. Of course, the study participants, who I'm very grateful for taking the time to provide insights, the PERFORM2Scale Research Consortium, and the European Commission Horizon 2020, who funded PERFORM2Scale as well as this PhD. Thanks.